Hello friends, today I'll discuss a short talk regarding gallbladder stone, which is a common problem in North India. The gallbladder is basically a pear-shaped organ which is attached to the liver, and the bile which is formed in the liver gets stored in the gallbladder, which is later goes into the intestine and get mixed with the food to cause digestion of the food. Whenever the component of the bile like cholesterol or bile pigment increases, there is formation of gallbladder stones. The symptoms of gallbladder stones are basically distensions of abdomen after having heavy meals or discomfort, or sometimes patient can have pain in the right side of the upper abdomen, or which can radiate to the back and right shoulder. Sometimes these gallbladder stones can be silent stones, and absolutely there is no symptoms, and they lie in the gallbladder without causing any kind of symptoms. But if these stones are in patient having diabetes, or if these stones are very large, more than 2 centimeters in size, then the treatment is required. The diagnosis of gallbladder stone is very simple. By a simple ultrasound of abdomen, one can be easily diagnosed whether the patient is having a gallbladder stone or not, and it is almost a confirmatory diagnosis. One does not need a very special investigation or test to get diagnosed these gallbladder stones. Many persons have many kinds of doubt after being diagnosed with gallbladder stones. The thing is that we rarely pay attention to this organ until there is a problem, and most gallbladder related problems are very painful. Particularly, this kind of stones is the result of our unhealthy lifestyle, particularly food. So many foods are helpful for gallbladder health. Some such kinds of foods are fiber-rich foods. Particularly, fruits and vegetables are rich source of fiber and a must in a balanced diet. Particularly banana, which is highly rich in fiber, it is helpful for prevention of gallstones. Then water not only helps hydrate the body, but also it helps maintaining the water level required in vials. Ideally, a person should drink 8 glasses of water per day. This should not be drunk at one time, but should be spaced out throughout the day. Drinking too much water at a time will result in the body expelling it in the form of urine instead of absorbing it. Then next food which is helpful for gallbladder health is food rich in pectin. Pectin is a dietary fiber that binds cholesterol in the stomach and help in its removal from the body. Since cholesterol is one of the major causes for gallstone, eating pectin-rich food helps reduce the risk of gallstone. Some foods that are rich in pectin include citrus fruit, strawberry, and apples, which are commonly available. Then the next important food which is very much important for gallbladder health is flax seeds. Eating just 1 tablespoonful of flaxseed a day can boost your health in a number of ways. One of the many benefits of including flaxseed in our diet is healthy gallbladder. Flaxseed contains mucilaginous fiber or fiber that forms a gel This type of fiber aids in the liver synthesis of biles, acids, and thus keeps the gallbladder healthy. Then another most important agent, that is omega-3 fatty acid. Not all fats are bad for the body. It is the good fat which is known as omega-3 fatty acid which play an important role in producing anti-inflammatory compound. Some rich source of omega-3 fatty acid include olive oils and flax seeds. Then citrus fruits, which are commonly available, most economical, and they are the rich source of vitamin C, which deficiency particularly causes gallstones. Means deficiency of vitamin C partially results formation of gallstones. As formation of gallbladder stones is related to lifestyle, particularly food habit, saturated fat containing foods and sugar has a role for the formation of gallbladder stone, and simultaneously it believed that consumptions of very low amount of alcohol daily, mind it, very low amount of alcohol daily means 20 ml of alcohol maximum daily consumptions, and consumptions of coffee is helpful for dissolving gallbladder stones. And most important thing is that many kind of doubts arises in the mind of patient or person when they are affected by gallstone or when they are detected by gallstone. First thing is that losing of weight. Whether losing of weight leads to gallstone? Yes. Losing of weight leads to gallstone. How and how? Losing of weight at more than 1.5 to 2 kg per week is considered to be a rapid weight loss. Okay? It increases the risk of gallbladder disease. Although cutting down on food that contain too much fat is helpful when you lose weight, but still consume some fat so that the gallbladder contracts and keep secreting bile. When you totally cut back on your food and fat intake, you need less bile. The bile becomes more concentrated and the gallbladder does not contract. This means that there are more chances of forming gallstone. Now come to the treatment part. So if the size of the gallstone is small or very small, then many homeopathic specialists and Ayurvedic specialists claim that can be resolved by homeopathic or Ayurvedic treatment completely. But the treatment protocol is little bit long term. But the main important thing is that if the size is little bit big, beyond the parameters of small size, then it is better to go for a surgery. Okay, there are mainly two types of surgery. One is a laparoscopic surgery known as laparoscopic cholecystectomy, and other is open surgery known as open cholecystectomy.